is Dr. Wayne Kelly. I'm the medical director of Compassionate Harvest Medical Clinic. Medicinal marijuana can treat mostly chronic pain-related symptoms, depression, anxiety, insomnia, chronic fatigue. It's amazing to me the number of medications, prescription pharmaceutical medications, that cannabis can take the place of. And in particular, I mean the painkillers, the pain medications, opiates in particular. Well, I got started because of patients, really. I was asked by a patient with MS, multiple sclerosis, to do a medical marijuana evaluation for her. And I did as a favor, and at that time I didn't know much about medical marijuana. And she had a tremendously positive response to it with her muscle spasms and the other symptoms of MS. Age, I see primarily 21 to 90 or 91 years old. That's my oldest patients. We see a lot of senior citizens. The majority of my patients do not trust the medical system. They've been wounded in some way, or you might call them walking wounded. They've had bad experiences. Many of them don't have insurance and have not had access to good health care. And they want to have control over their bodies and what they take. They see cannabis as an organic, benign substitute for prescription medicines that they can control themselves. Side effect of cannabis is euphoria. You feel better. You know, medical cannabis is legal because we're using it medically, but it's not supposed to make you feel better, right? But it does, and that's a lot of seniors have discovered that and enjoy it, and they feel like it improves the quality of their life. It's a simple, easy process. You can make an appointment to see us, or you can just walk in. We take walk-ins at the office. If you have medical records or pertinent lab results or MRI or X-ray reports, we ask that you bring those, and we can scan them in and add them to your file. They're not required, as we believe our patients. We believe the medical history that they provide us. So we can go basically on the history that the patient presents. If you're coming in because of insomnia and anxiety, who else but the patient knows that they have insomnia and anxiety? So just like any doctor, we have to believe our patients and take them at their word. So when the patient comes in, we ask them to fill out a medical history form that provides the information that we need to issue them a license. This usually takes about 10 minutes. Patients can also do this online on our website, fill out the medical history information so that we can have it here available. If they do it online, it's even a quicker and simpler process. With the license, where the patient is able to go to any dispensary and in California, buy and use whatever they wish of medical cannabis. They'll be completely legal as a buyer and a user of cannabis. They can also grow it up to 6 flowering plants. They can transport up to 8 ounces legally, though we warn all patients not to use while driving and to preferably transport the cannabis in the trunk of their car in a container, so it's very clear if they're ever stopped that they're not using while driving.